opportunities that nurses are facing with the evolution of healthcare reform and the need that we have to serve the public in different ways. When you think about nurses in practice, you most oftentimes think of them practicing in acute care settings, whether that's the hospital or a primary care setting where they really are delivering one-on-one patient care. But what we know is that the role of nurses is changing. We can see this happening in the role of telehealth. So for example, if a nurse is caring for a population in a rural area of Washington State, we know that they can have access to resources that they may not normally have with telehealth. Being able to provide resources, access, and consultation to the providers that are experts in more urban areas at academic health centers gives nurses the opportunity to provide chronic care management to the patients that they're serving, regardless of where they live. We also know that community health nurses are changing. Community and public health roles are evolving because we know that nurses who have the ability to care for populations need to be practicing at the highest scope of that level of practice. So nurses that are prepared with the competencies, the knowledge, the skills, and the attitudes to deliver care to populations in community and public health roles are going to be able to make sure that people have the services they need when they need them and where they need them. And speaking of giving services where they're needed, we know that mobile clinics are a way that nurses can access those populations that are oftentimes underserved. Mobile clinics offer a way for nurses to be able to care for patients, for families, and for communities, even if they don't have access to the resources that we typically think of in more urban areas. Another area that we're seeing nurses make a really big impact in the world is in that of disaster relief nursing. Nurses are already skilled with the skills to be able to care for patients and families in emergency situations, and having them take the role of the lead of disaster relief teams is really proving to be beneficial. As we see more and more disasters happening throughout our state, our country, and across the world, nurses can make a difference in the lives of people when they are encountering a disaster. We also see that nurses are evolving in the role of chronic illness management, whether that's caring for older adults who are developing chronic illnesses across the lifespan, or those children who develop chronic illnesses younger in their lives and have to learn how to deal with those and manage those as they grow into adulthood. We know that nurses are the best at being able to advocate for patients and their families whenever they need that care. Home health nurses have a long history of providing care to patients in their families, and now we see with the emergence of the healthcare reform, nurses are taking on more roles in leadership of creating the teams that work in home health. Nurses are also developing the skills and abilities to inform research, whether that's at evidence-based practice implementation from the bedside nurse or the doctoral level of nurses developing and implementing evidence-based practice. Nursing research is critically important for informing both nursing education and improving healthcare. Nurses are also being turned to for informing health policy. As nurses are the closest to the patients, the advocates that they need the most, nurses know what patients need, they know what families need, and they know what communities need, and they know how to help legislators understand what those needs are. Nurses are becoming one of the most sought after advocates in health policy, whether that's at the legislative level or the organizational level in health systems. And here in our region in northern Washington, nursing education is a critically important need. We don't have enough nurses prepared at the baccalaureate level to move on to get their master's and their doctoral levels to be able to serve the needs of nursing students wanting to become nurses. So in order for us to be able to meet this need in our community, we know that we have to support one another in continuing our education and supporting nurses into becoming advanced practice nurses, nurse researchers, and nurse educators. And that just touches on a few of the expanding roles that we see for nurses in the healthcare team today, and the reason that we want to support our colleagues in pursuing further education.